Welcome to the Truth and Fertility podcast. I'm Haley, wife, mom, and a fertility charting instructor, here to teach you the undeniable truth about your fertility. So let's get started. Welcome to the Truth and Fertility podcast. Today I have on Dr. Christy, Sunny, and I have on nurse Megan Davis. Megan has actually been on the podcast before to talk about this very topic, but now I have both her and Dr. Christy on today to talk about what women's health looks like in the realm of restorative reproductive medicine or NAPRO technology, a very, very different way of practicing medicine in the women's health sphere than we think about women's health when we hear that word and what we think of, what our culture thinks of. We practice it a little bit differently, a lot of it differently. So I wanted to pick Dr. Christy and Megan's brains today, just to talk about their experience working in women's health in this specific way and how that's been different for them versus what typical women's health looks like. So without further ado, I'm going to let them introduce themselves. Dr. Christy, if you want to start and just introduce yourself and talk about you and what you're doing.
Yeah, thank you so much for having me. My name is Dr. Sunny. I've worked with Megan and Haley for the last year and a half, and so it's really nice to do this podcast with you. I'm a family medicine doctor, but I also practice obstetrics. So I deliver babies. I am trained in NAPRO technology. I do a little bit of NAPRO technology with women's health. So with gynecologic disorders, postpartum disorders, prenatal care. So I've been doing that for about a year and a half.
That's great. Awesome. Okay, Megan, if you want to introduce yourself.
Yeah, my name is Megan. I am so excited to be back on the podcast again. Like I mentioned last time, I've been a nurse. Now it's been almost 2 years, which is crazy. It went by so fast. So shortly after I graduated from nursing school, I also got trained in becoming a Creighton model fertility care practitioner, just like Haley is, which was really amazing to go through that program and learn so much that really wasn't even touched on in nursing school. So much more about the woman's body and just like reproductive health in general. So that was a really wonderful experience. And then to get to practice that kind of medicine at the clinic that I work at, and also get to be a practitioner and serve our patients in that way, has been such a blessing. And just to see the benefit that this has on women's health and their lives. And it's just been a real gift. And so I'm super excited for our conversation today.
Awesome. Yeah, I'm glad to have you guys on. So one thing you said, Megan, that I want to hone in on first is that you said this is not something that you learned in school. and I feel like every time I've talked to a nursing student, a PA student, a med student, they are always saying, like, I have never learned about I never learned what natural family planning was or fertility awareness-based methods. I never learned what NAPRO technology was. I never learned about women's health in this way. So I'm sure that's true for you guys. So maybe if you want to shed some light on what you did learn in Christy in med school, Megan in nursing school, and then by not learning this type of medicine a whole lot, how did you end up in this space of women's health?
I agree with Megan. There's so much that I didn't learn that I got taught while I was doing the medical consultancy program at St. Paul VI Institute. Our family medicine doctor, you are expected to know some amount of obstetrics, some amount of gynecology. It ends up being a lot of contraception, IUD placement, Nexplanon placement. So we had training for those things. Like we had training in medical school. But we had even more training in residency. And so how to put an IUD in, how to put an Nexplanon, and we had people come in to teach us. It was something that we were taught to do because it's what everybody wanted, long-term contraception or sterility was always kind of talked about and taught in the residency program because it's taught as like, not that it's a bad thing, it's a great thing for women. Women have the choice to do this. Their reproductive rights, their freedom, they're able to, if you're not having children, you should be contracepting. that's what my program director taught, and so there was no why aren't you contracepting is the question, and so I never prescribed. I did learn the skills because I thought it was important to know how to do things, even if you weren't going to actually do it, because I wanted to be able to talk to my patients about it. So I learned the skills, and if I wanted to remove it, I wanted to learn the skills. So I know how to remove it. I do know how to place it, but I don't place it. So during the medical consultancy program, that's really when we talked about NFP. In residency, NFP was nothing that we ever talked about. They would talk about the rhythm method, and that's it. They would say, oh yeah, so there's this thing called the rhythm method. It doesn't really work. And that's it. That was the end of the discussion. That was the end of the studying. That was it, And so I always thought it was a nothing. Like a nothing thing. The best thing to do was place an IUD, which is supposedly 99% accurate and effective in preventing pregnancy, right? And so going to St. Paul 6 Institute and learning about how do these hormones even work properly? How does that chart work? And then talking about what natural family planning is and what those methods are. So that was my first time talking about cervical mucus. I didn't know that there were crypts in the cervix that produce different types of mucus, and there's things that can stop sperm from penetrating, and there's ones that would allow it to penetrate better. I mean, that was so new to me, and I took full anatomy, physiology, and pathology, in medical school, and it was such a game changer and such an eye-opening experience for me. And so being able to, or being taught NFP, or one method of NFP, which is the Creighton method, and being able to actually practice it, I think what I get to do as a physician is give my patient more of a choice. I don't think contraception is your only choice, whereas in the regular world, mainstream world, contraception is the option, right? There's nothing else. So if a woman doesn't want to be on contraception, or can't find a contraceptive method that works for them, they have no other options, they have no one to turn to. So if they have something that's causing irregular bleeding, all they do is, try this one, try a higher dose, try a lower dose. It's that there's no clear-cut answers. So being able to help women, really truly help women, that has been an amazing benefit from knowing NFP. And then the other part is knowing the root cause of issues. If I have a patient that comes in with PCOS, instead of being like, oh, well, here's the answer, here's a pill, or here's an IUD. This will treat all of your problems. No, we know that it doesn't treat anything. And so it gives me the freedom to practice medicine appropriately. It gives my patients the choice real choice to take care of their bodies. And I think that should be present for all women all around the world.
Yeah. Megan, how about you when you were in not med school, nursing school? What did that look like?
Definitely. I feel like my experience was very similar to yours, Dr. Sunny, when we did our unit or our semester, I guess, in maternity and OBGYN, because with nursing school, we cover a lot of different topics, each semester, different specialties of medicine and things. And I remember when we talked about in OBGYN, obviously all the different forms of contraceptives, kind of the same thing. They just lumped all the NFPs together in this one, fertility awareness-based method. And then they barely spent a slide on it and just said, oh, this is when you count the amount of days, and on the 14th day you ovulate, and it's not very effective, et cetera, et cetera. But then, all the different forms of contraceptive each got, separate slides, and you go over them in much more depth. And it just always kind of felt very rushed through. And going to the first education phase of becoming a Creighton model practitioner, which we were all at together, that was just such a amazing experience. And I learned so much about how the woman's body is supposed to work, where the hormones are supposed to be at different times of the cycle, and all of that. It was just very eye-opening that none of this was taught. I was graduated, had passed my nursing boards, all of that. And yet this was all such new information for me, which was just crazy. So I definitely have seen how empowering this can be for women to learn this information that we're teaching them. I've given the introductory session of the Creighton model so many times and had women say, you know, this is the first time I'm hearing this, or, you know, I went to public school, got the basic like sex ed, but I've never learned what actually is going on in my body. And it's just beautiful to be able to give that gift to women so that way they can understand and, like you're saying, Dr. Sunny, like make an educated choice on, you know, what they want to do. But it's like women are lied to a lot of the time, and they don't realize the detriments that these different forms of contraceptives can have on their body and what it is doing to their hormones. Yeah.
Yeah, for sure. You know, and it's interesting too, because I've been doing some research on different OBGYN clinics just in our area, just for business purposes, and like telling them like, hey, here's another option. I can teach your clients if they want a more natural option. So I've just been doing some research on the clinics around me, and there was one that they had a beautiful website, and so I was kind of just looking at it and just getting familiar with it. And I was looking at the different services they offer, and it said, one of them said endometriosis, and so I clicked on it because I was interested to see what they had to say. And this is not a clinic that does restorative reproductive medicine. They don't do naprotechnology. It's just mainstream OBGYN clinic. And it said, I clicked on the endometriosis one, and it said, there is no known cure for endometriosis. However, there are ways to manage it, one being the pill or some sort of contraceptive. And I was just like, no. We're learning now that there is a cure. It's a surgical cure. So it's actually going in via surgery and removing the endometriosis. But there's just, I'm realizing too, even that exactly what you guys are saying, that there is a total lack of knowledge of the women's body, but the women's reproductive system. And like, yes, there are crypts within the cervix that produce this mucus, and this mucus, sperm cannot live without this mucus. Like there's so much there that is not taught. And it really just blows my mind every time I talk to somebody who's gone through some sort of medical training, because they're just not taught. Now, my next question for you guys is, so for those of you that are listening, both of these lovely women, we all have experience working at a clinic that is specifically a naprotechnology clinic. So the type of people that are going there are probably not the type that are seeking contraceptives. But that being said, I want to ask you guys, or even in your training in med school, nursing school, did you ever have any pushback on, saying, okay, I'm not going to be prescribing contraceptives. I'm going to be practicing this other type of medicine. Like, have you had any pushback on that, and what does that look like?
Yeah. Can I just say one thing? I just wanted to add one thing, just going back a little bit. There technically isn't a cure for endometriosis, and there is treatment. So there is surgical treatment for it, but those lesions can come back. So it's yeah. And so
thank you for the clarification. Yeah,
I just wanted to make sure the listeners understand.
Sure.
But, people make it seem like, oh, endometriosis, you're never going to have babies, you're going to be infertile, but that's not true. With excisions of these lesions and taking the appropriate steps to getting pregnant, it is possible to achieve pregnancy. It is possible to get relief from pain. And so those are things that naprotechnology does do, and it can be different for different people. For some people, that could be it, and that could be the treatment. But then for other people, it needs to happen more often. They need to do surgeries multiple times.
I see. Okay.
And so the time frame varies. It's very subjective. Anyways, I just wanted to add that. But going back to your question, I got lots of pushback. I was the only resident that didn't prescribe, and I was the only resident that was interested in women's health. So for my program director, for my residency, everybody thought I was foolish. Nobody understood how I could want to take care of women, how I was so passionate about women's health, but I didn't want to prescribe. It was, for them, it was just like, what? This doesn't make any sense, And at the time, like I didn't have the tools in my toolbox to be like, well, this is what I actually want to do, because I did the NFP, like the St. Paul Six Institute classes after residency. So I didn't have that in my toolbox. So I couldn't be like, well, this is how I want to practice. This is what I want to do for my patients. I just was like, yeah, I just won't do it, and they didn't love it, but they didn't push me to do it, and so I never had to prescribe, which I think was a blessing for me. I was able to talk to patients a little bit about NFP. So I would kind of like point them to NFP instructors, but it was very rare occasions because I didn't make it. I didn't advertise that, hey, I don't prescribe, but let me help you, because I really didn't have the tools to give them that, But I was able to talk to residents. I think more than anything, it was like the residents, like my co-residents, that I was able to talk to about not prescribing and why I didn't want to prescribe, how contraception, it's not just preventing conception. These are abortifacients. So I was able to do those things. I think that's where maybe like my practice, what I was able to do with my practice during residency. But after doing the class, I think it's so different. I'm able to do so much more. We have, when I was working at Morningstar OBGYN, we've had clients that are not Catholic, they're not Christian, they're atheists, completely atheists. They don't believe in God. We had people that were Muslim, and I was able to talk to them about NFP. And I think that was something that I thought I would never be able to do. I didn't even imagine that, so they were open to it. I gave them like the sheet that we have that explains the different types of methods. And then I think a couple people maybe have even set up appointments, but even if they didn't set up appointments, at least they got an option that they could research about, look into it, and then decide if they wanted to go down that route or not, and so, yeah, I just feel that, yeah.
Yeah. Well, and also too, I think it talking to people that are not religious about this, I think is becoming easier to do because it's really focusing on science of women's health. And when we actually we're starting to recognize more and more how just plainly unhealthy the pill is, or any other hormonal contraceptive is for our bodies. Like, we're starting to recognize that. And so you can even keep it on a purely scientific level, not bring religion into it at all, and still explain why this is the better option. So I think that is gold right there to be able to do that. Yeah. Megan, how about you with pushback?
Yeah, I was just going to comment on what we were just talking about back to like before I get into the pushback comment. But yeah, I feel like there's a huge rise, and maybe you like saw this too, Dr. Sunny, as well, just in your practice, but like people really want to do things in a more natural route. And I feel like just even, I don't know, I felt like maybe several years ago, the idea of doing NFP was like a big thing in like certain religions, like Catholicism, etc. Like they felt like this was a Catholic thing to do, right? And now I feel like people are just looking for a more natural way to, regulate their body and understand their times of fertility and infertility. And I feel like there's a huge rise in that in medicine, of everybody wanting to do things the natural way, the holistic way. And so it's beautiful to see that this truth is coming out to people, even if they're not trying to do this in a for a moral reason, let's say, they're trying to do this for a natural way. And that's such a beautiful way to lead them to that truth, which I think is really wonderful. And to see that, and to get to teach so many women that aren't religious or aren't Catholic, etc., whatever, but to get to share this truth with them has been such a joy. And I've really enjoyed that. But getting back to your original question, Haley, I feel like more so, not necessarily pushback, but just my experience with learning more how to articulate what I do in the work that I'm doing at the clinic and being an NFP instructor has come just in the last couple of years while I've been doing that work and sharing that with the people around me that maybe have different views or things like that, but getting to articulate that to them and explain the science behind like why our clinic doesn't prescribe contraceptives and why I'm being an NFP instructor and pursuing this kind of secondary or like additional certificate in addition to my nursing license has been just really cool to have those kind of conversations with people, because sometimes, people hear OBGYN and they think, IVF, they think all of these other things, and to get to share what we do and how we are different has been a real gift.
Yeah, for sure. And I think too, I was thinking about pushback from like your peers or your teachers or professors, right, in school. Now I'm also more thinking too about our patients, like any pushback from that. And actually, I'm thinking of a specific patient right now because Dr. Sunny, you referred her to me because she was on the pill, and you had told her like, hey, by the way, do you know that NFP exists? And so this is a prime example of somebody that came in not like I think going back, she would have done this her whole reproductive life if she had known about it, but she didn't know about it. And she just knew the pill, and her body never had issues. Like when she would come off the pill, bam, have a baby. Okay, great. And then get right back on. Like she was one of those people that had no adverse side effects or anything to the pill. Like she was the perfect pill patient. But then she came to you and was like, I don't know how that conversation went, but she just said that you had mentioned to her, hey, there's another option if you want something more natural that's better for your body. And so she swallowed it whole. I mean, she was one of my best patients. I just loved her to death. Yeah. Because she's like, why have I never known this? Like that, exactly what Megan, what you were saying, like, why have I never known this? Why have I never been taught this? So that is best case scenario. You tell somebody about this other option, they take it, they love it, they go and tell their friends about it, and it changes them, right? Have you guys ever had a different type of example where you've talked to a patient about it and they are just not into it? Like they're not understanding, or they just don't have the mindset to quite understand.
Oh yeah, lots, and that's okay. I think that's kind of part of it, in an ideal world, everybody would be doing this and everybody would be able to catch on and, all of those things. But there's a lot of patients and their reasons are not, I mean, everybody has their own reasons. I can think of multiple patients. One of them is like, oh I could never. The one is like abstaining. Like I could never abstain. Like my husband would never be able to abstain. And I'm just like, okay. I mean, what can you say at that point, which is fine. At least I had that time to like kind of explain to her or give her that option, and it's like, you have the freedom to choose, right? This is like, we're not trying to force anybody into one thing. What else? I've had patients also that were like open to it. They would try it, and then after like the first couple weeks of like charting, they're like, this isn't for me. And I'm like, no, come on, stick with it. You got this. You have to give it time. It's like, I always say it's like learning a new language. It takes time to learn a language. And so once you get into it, and then you figure out how to chart, it's going to become second nature.
I think it's so important too of like to plant the seeds, of these kinds of things, because you never know, like a conversation that you have with a patient that maybe, doesn't go so well, or they're not open to it at that time, like maybe months, years, etc. down the road, like they might think about that conversation and be searching for something else and remember this conversation that they had at an appointment with their doctor, or a conversation that they had with someone at the clinic that reminds them that there is this other option out there, right? So even if now isn't the time that they're open to it, you never know how that conversation will impact them in the future. And I totally agree. The first couple weeks of charting are so hard. And I usually tell clients, like, you are putting in the hard work now for something that you can use the rest of your reproductive life. So like these first couple of cycles, these first couple months, it's going to be hard to learn this like new routine. But once you get it down, like you'll be able to use this long term for both achieving and avoiding pregnancy. So it's like you're putting in the hard work now to be able to use this in the long term. And I had a client at one point say to me, like, yeah, it's kind of like how you have to remember to take your birth control pill every day. Like you just have to remember to do your observations every day and every time before and after you go to the bathroom and do your charting. And she's like, it's kind of the same thing. And I'm like, yep. same part of your brain,
Sure.
same memory. Yeah.
Yeah.
I mean,
Go
sorry.
on. No, sorry, go on. You go on.
I just wanted to say, like, I mean, you're right. Like it is just like taking a pill every day, or maybe like showering or shaving, or you try to look and see like, oh, do I have any hairs? I have to like shave it. It's like, I know it's a silly analogy, but if I think a lot of the difficulty is because we have to unlearn what we've been taught. Like NFP is like a new method, and so quote unquote new method, but it's like we're unlearning things that we've been taught in high school, or like even like even starting in junior high school, college. Like no one actually sits down and tells you, well, in the beginning of your cycle, your estrogen is here and your progesterone is here, and then you ovulate and then your progesterone goes up and this is what happens. And then there isn't this clear cut teaching that happens. It's just like, oh, you're gonna start having a menstrual cycle and then you can start having babies, so we want to prevent that, and so here's a condom, or here's this, and so if this was something that was just taught, like the physiology was just taught right away, and men and women understood the physiology, it wouldn't be as difficult of a like topic, or like charting wouldn't be as difficult to do.
Almost like a sell. It's almost like you have to sell it to people, because it's not what we're taught originally. So you're unteaching what they know incorrectly, and then you're explaining why this is correct. Actually, my mom always jokes with me, not maybe always, but she has joked with me in the past that one day I'm going to write a book just called Why I'm Right. Because I mean, this is true women's health, even though it's not the norm of what you see in women's health with contraceptives or IVF for infertility. And it's such a different way of practicing. But when you look at it and you truly learn about it, it's really getting down to the root cause of what is actually causing your irregular periods, your painful periods, or whatever it is. It's getting down to the root of what that actually is, and then healing it from there. Or even if a woman is completely healthy in her reproductive system and is just trying to family plan, like, why are we giving her a pill that shuts down the whole reproductive system in her body? Like, why are we giving her something that shuts it all down? There's no other part of medicine that does that takes something completely healthy and then purposefully shuts it down. There's no other part of medicine that does that. So why are we doing that with women's reproductive system? So I just think, like, when you can unteach to then reteach the truth about what this is, it expands your whole idea of medicine in general, I think, but then just also like the dignity of the woman, and how are we treating her, and are we actually taking the time to understand, okay, what is going on with your hormones, what is going on with your body, so that we can actually treat you well, diagnose you well, and then treat you well from that diagnosis. So yeah, I also wanted to ask too, kind of backing up a little bit, but for both of you, how did you even get into this space of medicine? Like, how did you learn about it? Because again, like, I didn't grow up knowing about this either. Like, I had to learn it on my own journey too. So maybe if you guys want to just talk about, for each of you, how you even came to this understanding of this new type of medicine and then wanting to practice it from there.
For me, it was just a friend that had shared her experience. She was one of the first few classes that went through St. Paul VI Institute. So she gave us a lecture at church, years ago. And I was in medical school at the time, so I was just like listening, and I was like, what is she talking about? And so that's kind of like where it started. And so there were all these just like mentors in church, like elders that would talk about NFP, and that there's this this is what we do in our marriage, but then no one really would, like, we were never taught it really. It was just something that they kind of were like, this is an option when you are older, when you're ready to get married and all of that. So that's the first time I heard about it. When my friend she's both a medical consultant and a teacher. So she gave the intro session to us as like a lecture. And so it was really eye-opening, like the chart, like how she talked about the charting and things like that. And so after the lecture, I sat down with her and she like went over how the Institute works, what you can do. And so it was something that I've always wanted to do. I just didn't ever have the time in terms when it came to like medical school, residency, all of that, you know? So it was a blessing for me to be able to actually attend the course last year and the year before, and be actually formally taught NAPRO technology.
I feel like my story is almost like a little bit the opposite, in the sense of like I really didn't know much about NFP or NAPRO technology before starting this job. And my boss had said, you know, this is a big part of what we do at this practice, and I think it would serve you very well to go to this training and to take this course. So I really would love to send you to it. And of course, I'm just like, sure, it sounds great. And little did I know like what a big impact this would make on the work that I do, and even just my life, and being a woman, to have this knowledge, because I, you know, didn't know any of this prior to going to the course, and I just learned so much that I hope to continue to share with others. But yeah, I went to the course and I was just eye-opened at how much there is to learn about the woman's body, and how much is, like we've been talking about this whole podcast, like not taught in schools, even to, you know, like you said, junior high school people. And it's been really just such a gift to learn all of that. And so it's been a surprising thing. Like I never would have thought that I would have been an NFP instructor, but it's honestly been something that I've really enjoyed and want to continue to pursue, you know, for a very long time to come. So God's handiwork was in that for sure.
Absolutely. Totally. Okay. Last question to wrap up. If somebody is listening right now and maybe they're taking the pill, and whether it be for contraceptive purposes or for health purposes or both, what would you tell her? Like if she's listening to this podcast, hopefully she's a little open to a more natural form of family planning, or this different type of women's health that's really looking at the root cause. But maybe she's been on the pill for like 10 years and she's really afraid to get off of it. She doesn't know what her body's going to do. She just doesn't know what to expect, or doesn't know. It's just nervous or scared. What would you guys say to her?
If she's interested in doing something more natural, if she's interested in charting, getting to the root cause of something, I would say, you know, just take that leap of faith. You know, you're right. We're not really going to know what your body's going to do. We don't know how it's going to react. But it's okay. Like we'll figure it out. That's the whole point. You know, let your body just do what it's supposed to do. You know, it takes time, and time is so subjective, and it just depends on your body. And so, if this is someone that's like perfectly healthy, maybe things will like regularize right away. You know, but if this is someone that's been struggling with PCOS or you know, irregular bleeding or something, endometriosis, you know, things might take some time before it is normal. But the first step is just, you know, the fear is normal. You know, we're going to be there to like kind of help you through that part, but just take the first step, stop, you know, taking the pill and see what your body does. You're going to learn so much about yourself. I think that's really important, because, you know, your reproductive cycles will tell you about your overall health so much. And so I would just say, yes, it's scary, but you can do it.
Totally agree. Just to even piggyback off of what you just said, Dr. Sunny, like taking that leap of faith for sure. But also just like finding physicians and healthcare providers that will help to support you in that goal, I think, and putting yourself in a situation where you're going to be supported in that, and taking the time to look and find a good healthcare provider that will help you with that and support you in choosing a more natural method, because there are options out there like our clinic in so many different, you know, cities across across the United States. So many different wonderful physicians that want to practice in this way and want to support you in this way. So do research. I know that the Pope Health Institute, I believe, has a directory of medical consultants and, NAPRO surgeons and things like that, where you can find those nearby to where you are. So find those and, make an appointment and feel supported in this choice, because obviously, the way that our culture is and our world is, like, people will, give you a look like, what are you doing? Why are you getting off of the pill? But, find people that will support you, especially healthcare providers that will help to support you.
Yeah, for sure. And actually in the show notes, I will put a few links to different directories that I know of that, of doctors that are going to practice medicine in this way. They, it's funny because like 10 years ago, it would be so few and far between to try to find a doctor that would support you in this. But now there's a lot more doctors that are coming around, recognizing the truth of this type of medicine and wanting to be a part of it. So so I'll put those in a few directories that I know of in the show notes below for those of you that are wanting a doctor that practices medicine like this. And also, exactly, yes, Megan, what you said, like, don't do this alone. Like, either have your spouse be your support to walk with you in this. Get a good doctor that's going to help you understand like what is going on with your body. And just as Dr. Sunny said too, if your cycle was normal and regular beforehand, I mean, hopefully, yes, it'll go back to that. But if it wasn't regular and normal before that, most likely it's not going to be regular and normal again. And that's kind of to be expected. And so with that, just another reason to go find a good doctor that's going to help walk you through that, actually figure out what is going on hormonally in your reproductive system, and actually diagnose and treat you from there. Well, ladies, thank you so much for being on the podcast today. I really, really enjoyed our conversation. It's good to just take a step back and actually look at what is this medicine? What does this even practically look like for two people that actually practice this in the medical setting? It's good to just look at how the world thinks about women's health, and then the way that we are doing women's health, and how that is so much more different, but it's so much more restorative to the women's body and just to her dignity too. Because if we're not putting her health first and actually taking the time to look at the root causes of things, like, are we really serving her dignity well? I would argue not. So we can uphold her dignity by truly taking care of her and practicing medicine in this way, and teach and what I do, and teaching her, and Megan teaching her how to chart, so that she can then work with a doctor who knows how to read that chart and can help her out with the chart being that starting point. So any last words before we end our time today?
Can I just add one thing?
Yes, please.
Of the charting, like a lot of times we think of charting as like, this is for married people to avoid pregnancy or to achieve pregnancy. But I would say, like, if you're able to start earlier, like let's say you're in high school or college and you just want to start charting just because you want to learn about your body, you want to learn about your cycles, go for it. You could just learn that everything is normal and things are great. You could also learn that things are abnormal, and you can find a physician that can help you, or a provider that can help you, right? And so there's so many benefits to charting, right? Achieving and preventing pregnancy is just one side of it, but there's so much like pathology that could be found just by charting. Like, your teachers can look at it and say, oh, it looks like you might have an infection. Let's get you in and seeing a doctor and see if there is really an infection. Let's treat that, and so, or there's something abnormal with the bleeding and things that you would never expect. And so there's just more than one thing to do with this charting. So just being open to that.
Yeah, absolutely. That is really this is for women's health, which means that it's not it is for family planning, but if we're going to stop it at family planning, there's so much that we're lacking with it. Like, there's so much further that we can go with charting, because when you're charting your cycle, we're seeing signs or we may see signs of abnormalities, and then we go from there. So ladies, I will let you go, but thank you so much for being on the podcast today. Thanks for listening to the Truth and Fertility podcast. If you are enjoying this content, please leave a 5-star review. That helps me tremendously. For more information about learning to chart your fertility cycle, you can visit truthandfertility.com, and I'll talk to you guys again next week.